Your clinic design can make or break the patient experience. Here is how to get it right. In this expert video, we're going to talk about design considerations for patient-centered clinics. I'm Dave.
And I'm Ken, and we're with the team at Grosz & Ken Fulmer. I think first and foremost, it's important to review the existing conditions. Now, with a ground-up project, you don't have as many, right? You have kind of a clean slate, but a lot of times we're building these out in existing spaces, right? So it's important to understand, first and foremost, what's the square footage? Can this fit my need from a operational standpoint? Does it allow for the size of exam rooms that is part of the standard or whatever it may be? But size-wise, you want to make sure that your practice will fit and you can operate and things flow well. Also, the existing conditions in terms of the existing utilities, right? Oftentimes we're going into what may have used to be a party city in a strip center, right? So you can imagine the difference between the electrical capacity or the electrical need for that versus something with, say, 25 exam rooms and a activity center and some MA stations and a front desk. And, the power requirement there is significant. Not only power, but water, right? Going from 2 restrooms or maybe even 4 restrooms, 2 restrooms in a break room, to now all of a sudden there's an sink in every exam room. There's 6 restrooms throughout the space. It's capacity-wise is increased. So make sure you understand what's there. Make sure you understand what it's going to take to upgrade if need be, and make sure you understand what that process looks like.
Yeah, the second thing would be looking at the client standards and the brand consistency. So is this going to be a standalone clinic, or is this going to be part of a hospital system or part of another group that's expanding? And if that's the case, then they're going to have their standards of finishes, the wall colors, the millwork selection, the doors, all of that, so that it's the same across every clinic that the patient walks into. And having those standards make it easier for us on the front end to help with, again, budget considerations, material procurement. All of that has a huge effect on whether or not we're getting something that's obscure, that's a one-off for a one clinic, which there's nothing wrong with that. It's just, again, how we're going to be going about steering that ship and how we're going to be making sure that that process is flowing smoothly.
Yeah, and what patients see is important, right? I'll say even more so important, A, for the patients, but B, also for the city or the county or whoever, whatever governing body you're working with in whatever city, right? Accessibility, right? And ADA compliance. And that's just not at the city level or the county level, that's at the federal level. It's important, right? We want to make sure that the spaces that are being built are ADA compliant. And that applies to all commercial spaces, right? But I think more importantly, in a medical setting, it's important to ensure you're checking those boxes, right? And that can mean certain sizes on your restrooms, allowing for a particular turning radius, right? Grab bars placed in specific locations to allow for folks to use. And, I think the doorways, right? Certain openings, clear openings on doorways, corridors. There's just a lot of considerations to make when designing a space to ensure that it fits the patient's needs.
Yeah, and that goes along with the requirements of the AHJ and ties right into the patient comfort. Mm-hmm. So how do you take those elements that certain jurisdictions and the building code will require versus making it so that the patient does feel comfortable in the space? And a lot of clinics today, they're really being designed with this hospitality mindset, mm-hmm. where it's like walking into a high-end hotel versus like this old dingy lit cabinets are from the 70s type of a clinic. And you just want people who are coming into these spaces to feel at ease. They're coming in oftentimes sick, not feeling well. So the last thing you want is to lower that, just their overall mindset by having these old, outdated building elements versus something that's inviting, that's well lit. It's got a coffee station. They can grab a water when they come in. So all these little pieces will tie into having a clinic that somebody feels welcomed when they step into it.
Yeah, absolutely. And you know, the last point I'll touch on, and certainly of utmost importance, right, is staff efficiency, right? Designing for staff efficiency, right? All programs are a little different depending on your specific clinic or your specific practice, right? But oftentimes you have one doctor servicing 5 exam rooms, right? So you want that doctor's office near those exam rooms. In addition, you have usually MAs, medical assistants, who are helping those doctors, facilitating those doctors. So you want them relatively close to one another. So there's collaboration, there's communication, and that is relatively easy. You know, and from the patient's perspective, you want to make sure that you have a patient restroom next to the lab, right? If there is testing going on, and you have a specimen pass through between the two, right? You know, typically in you know, in the clinical settings, there's very specific needs which dictate how that is laid out and how that program works.
Yeah, you got to have the right flow
Yeah.
to the overall clinic for patients and staff.
Absolutely. Typically, you know, you bring them in this way, they exit this way, and there's a process to it.
Exactly.
Yeah.
So this has been another expert video, and feel free to check out some of our full-length podcast shows. And if you have any questions regarding a construction project you might be thinking about or have going on, please feel free to reach out to us at Wilson & Company.